Hi everyone, and welcome to TS Fibro. Today we are doing number 7 on the list of introduction to fibromyalgia. If you haven't seen the video Introduction to Fibromyalgia, you can go back and watch it, and then watch 1 through 6 of the videos I've done on the different symptoms, and you'll be caught up with us on number 7. So number 7 is fibromyalgia and sleep disturbances. A large percentage of fibromyalgia patients suffer from unrefreshing or disturbed sleep. You may have difficulty falling asleep, or you may wake up several times during the night, or perhaps you feel completely exhausted even though you've gotten 8 hours of sleep. These sleep disorders can contribute to pain of fibromyalgia, increasing muscle stiffness, exacerbating fatigue, and heightening depression. But sleep disorders may not just be a symptom of fibromyalgia. Instead, they may actually be the cause of a syndrome. What are sleep disorders? Any type of sleep abnormality can be referred to as a sleep disorder. Every time you fall asleep, your body goes through special changes. You actually progress through distinct stages of sleep, which are characterized by various changes in the body movement and brain waves. Every night, your body cycles through different sleep stages according to a specific pattern. People with sleep disorders experience difficulties in completing these sleep patterns. Deep sleep. Deep sleep is one of the most important stages of your sleeping cycle. Classified as stage 4 of the sleep cycle, it is during deep sleep that your muscles are repaired, your tissue is grown, and your energy is replenished. Without proper deep sleep, you would not be able to function at a normal capacity. Fibromyalgia patients appear to undergo less deep sleep than healthy men and women. As a result, they suffer from a variety of symptoms, including increased muscle pain, mood disorders like depression, fatigue, fibro fog. This lack of deep sleep may be what is behind the main symptoms of fibromyalgia. Somatomidin C. During deep sleep, a hormone known as somatomidin C is released by your body. Somatomidin C is responsible for ensuring proper nerve and muscle health. 90% of this somatomidin C is released during stage 4 deep sleep. Because fibromyalgia patients do not get enough deep sleep, they have a much lower levels of the somatomidin C. This could explain the extreme muscle and nerve pain that fibromyalgia patients suffer from. Insulin growth factor. Insulin growth factor, or IGF, also appears to play a role in causing fibromyalgia symptoms. Insulin growth factor is a hormone involved in the release of growth hormone, released during deep sleep. Fibromyalgia patients have much less insulin growth factor in their bloodstreams. As a result, these sufferers also have reduced growth hormone levels, which may be contributing to their pain symptoms. Controlling sleep disorders. Recent studies have shown that the key to managing fibromyalgia pain is controlling sleep disorders and restoring natural sleep patterns. This helps to increase energy and restore muscle and nerve health. Studies have indicated that the most beneficial ways of treating sleep disorders are a regular exercise routine and probably sleep medications. Does fibromyalgia keep you up at night? Here are some possible reasons why. Most people with fibromyalgia, more than 75% according to the National Fibromyalgia Research Association, complain of sleep disturbances and daytime fatigue. Experts believe that these feelings of grogginess and sleep deprivation are the results of problems falling asleep and staying asleep. While some people with fibromyalgia don't remember waking up frequently, others do recall these disturbances to a good night's rest. Either way, these abnormal sleep patterns prevent fibromyalgia sufferers from getting a healthy amount of restful, restorative sleep. The fibromyalgia connection to impaired deep sleep. There are 5 stages of sleep, and in the course of a normal night's rest, a person will normally cycle through various stages from light to deep to dreaming every 90 minutes or so. Dreaming occurs during what is called REM, rapid eye movement, sleep. Interestingly, EEG brainwave studies have found that fibromyalgia patients lack the restorative levels of deep non-REM sleep. It is during these deepest levels of sleep, also known as stages 3 and 4, that the body restores and refreshes itself. Stage 3 is characterized by moderately deep sleep, and stage 4, the deepest sleep phase, and when certain substances like growth hormones are released for body tissue repair and replacement. Research suggests that people with fibromyalgia are constantly aroused by bursts of awake brain activity, which limits the amount of time they spend in these critical deep stages of sleep. On EEG studies, fibromyalgia patients in deep sleep stages have been found to have alpha waves, which are signs of arousal or awakening. Dr. Patrick Wood, Chief Medical Advisor for the National Fibromyalgia Association, one study found that fibromyalgia patients experience at least twice as many arousal per hour as people without the disorder. Fibromyalgia's constant fog and fatigue. The lack of uninterrupted deep sleep may be the reason why people with fibromyalgia are also plagued by extreme daytime fatigue. In today's world, many people complain of feeling tired, but the exhaustion associated with fibromyalgia is much more severe. Fibromyalgia patients report feeling as if their bodies have been completely drained of energy, which can lead to limited physical and mental function. It is also common for people with fibromyalgia to have problems with concentration, thinking, and even memory, a condition known as fibrofog. One possible reason: memories are processed during sleep stages 3 and 4. During these 2 stages of sleep, the brain sorts through information accumulated during the day, taking it out of short-term memory and putting it into long-term memory, says Dr. Wood. When the amount of deep sleep is reduced, experts speculate that the body may have a limited ability to repair and replenish the brain functioning, affecting memory as well as energy. Brain chemicals, the root of the problem. While the cause of sleep problems in those with fibromyalgia are not yet completely understood, research is uncovering possible links. One theory is that the brain chemicals may be out of whack. There's very good evidence that fibromyalgia is associated with abnormal amounts of dopamine, which is an energy-related neurotransmitter or brain chemical. Norepinephrine, another energizing neurotransmitter, and cortisone, a hormone associated with stress, have also been found to be abnormal in fibromyalgia patients. In addition to interfering with restful sleep, neurochemical and hormonal imbalance may exacerbate the pain associated with fibromyalgia. In the opinion of experts, other researchers believe that it is constant pain that triggers deep sleep abnormalities. More studies are currently underway that may help uncover more definite causes of sleep difficulties associated with these painful, life-altering conditions. It's a hope that in the next 5 years or so, scientists will have more answers about the connection between fibromyalgia and sleep disorder. What about your medication? Some fibromyalgia medicines target the pain keeping you up at night, and some may help with sleep quality. An extended release version of the drug may do a better job easing pain so you can get more and better sleep. but not everyone is helped or helped enough by medication. Everyone is different. Not one thing is going to help everyone. It's going to take trial and error and your doctor and you talking and figuring it out. Many people with fibromyalgia have other sleep disorders. For more than half of them, it's restless leg syndrome. Having both conditions can make you sleepier during the day. Sleep apnea causes dangerously pauses in your breathing while you sleep. Because the sleep problems of people with fibromyalgia are so similar, researchers are looking into whether sleep apnea treatments help, even without an apnea diagnosis. Exercise is a dirty word to most of us with fibromyalgia, but stretching and doing exercise will help. Regular exercise is an essential part of fibromyalgia treatment, but timing matters. Daytime workouts can improve nighttime sleep, but activity within 3 hours of bedtime could wind you up too much to fall asleep. Workouts in a pool may feel less taxing because the water cushions your body. The ancient mind-body practice of Tai Chi combines meditation with slow, gentle movements and deep breathing. It can all add up to a better sleep quality, less pain, and lower stress. Soothing sounds. Listening to music before bed can enhance sleep. People with fibromyalgia in a 4-week study could adjust the sound and how long they listened and replay it if they woke up during the night. Everyone heard the same mix, music to promote sleep. On the Sonic Egg label was chosen for its specific beats. Cognitive behavioral therapy. The brain is a powerful tool for wellness. The technique called cognitive behavior therapy, or CBT, teaches you to change thought patterns for the better. Using CBT for fibro-related insomnia may improve alertness and thinking ability and lessen anxiety. It can be especially helpful if you're stuck in a negative thought spiral. Many people worry that they won't be able to sleep because of their pain, which in turn makes the pain worse, so it's harder to sleep. It's a vicious cycle. Healthy sleep habits. When you see a sleep specialist for insomnia, you learn about good sleep hygiene, habits that help promote sleep. These very simple steps can help lessen pain and fatigue and improve your sleep quality. Make sleep a priority and set a sleep schedule. Go to bed at the same time and get up at the same time every day, weekends included. Create a tranquil bedroom environment. Loud noise like a blaring TV can worsen chronic pain. Keep the room dark, quiet, and cool. Treat yourself to a comfortable mattress and bedding. Now, not everyone can follow this sleep pattern. Not everyone can have a certain time that they go to bed because they may have children or babies that they've just had and they're having to wake up every couple hours to feed them. So not everyone can do this. So don't feel bad or don't try too hard to keep to this like a specific bedtime and wake up. Some of us are exhausted, and especially on the weekends, if you work during the week, you want to sleep a little more. You may not get hardly any sleep at night, depending on if you have children or not. So take all this information. Like I said, it's my research and it's my opinion. So take all the research that I've done and just kind of adapt it to your life. You know, some things you're going to be able to do and some things you're not. Don't feel bad about it, because when you feel bad or guilty about it, then all it does is make the pain worse, your fatigue worse, and stress levels always make everything worse. So do what you can. Try to think happy thoughts. It's hard, I know sometimes, but listen to upbeat music. Think happy thoughts. try to stay happy. Well, I hope everyone enjoyed the video. Thank you all for coming. Please don't forget to subscribe, like, and hit the notification bell so you're notified when I drop another video. I appreciate everyone listening to my videos. I pray for a cure, and I pray that you have a pain-free day. God bless.